Hi, and welcome to the Healthcare AI Machine Learning broadcast. This week we've got a great show. I'm your host, Mike Mastanduno, and we've got a couple of new faces. Here we have Mike Dow. Mike, tell us a little bit about yourself.
Sure, I'm Mike Dow. I'm Director of Product Development, focusing on natural language processing and text analytics here at Health Catalyst.
And we also have Ethan Taft. Ethan?
I'm Ethan Taft. I just started here at Health Catalyst. I'm an intern, and I studied statistics at the University of Utah, and I'm here now.
So great. Really excited to have you both on the show with us. We've got a great show this week. We're going to be talking about natural language processing, which is, it's a closely related field to machine learning. Not exactly the same thing, but, they go hand in hand because a lot of times, you'll take the outputs from natural language processing and feed them into a machine learning model, or maybe you could even go the other way around.
Yeah, there are definitely machine learning techniques that we use in natural language processing.
So great, really excited to have that be the main event of our show, but a couple of housekeeping things as you've all become aware. You can log into YouTube and please join the chat. We really want to interact. Mike's got a lot of knowledge about, a lot of different things, but if please restrict your questions to natural language processing and we'll be happy to interact with you. You can subscribe to the YouTube channel or the Slack channel to join the community and get notifications about the future and upcoming broadcasts. We will be looking at some code this week, so if you need to change your resolution, that's in the gear in the lower right corner of the YouTube window. And finally, I just want to make a plug for the 2-day machine learning workshop that we're hosting here at Health Catalyst this September called at the Healthcare Analytics Summit. So HAS 2017. You're welcome to look that up, and we'd love to see you there in person. Otherwise, we'll just jump right into the show. We've got a great show this week. We're doing a couple of news articles that were pretty interesting, and then we'll do a little hands-on demonstration of some sentiment analysis in natural language processing. And finally, we'll move on to the main event and pick Mike's brain on NLP and healthcare. So, Ethan, can you? What articles do we have this week?
Yeah, so we actually have two really interesting articles. The first article is about a scientist who is developing algorithms and machine learning techniques to aid in helping healthcare providers, specifically in the field of mental health care. And the goal of the algorithm is to detect conscious and subconscious facial expressions, tone of voice, posture shifts, and gaze. And the research has already been successful in detecting depression in patients. And I think the reason why it's so interesting is it differs from traditional facial recognition software, where the traditional type is trying to detect things that stay the same all the time. And this new algorithm is trying to detect things that are different. So I think that's why it's really a really cool thing. Do you guys?
And it's healthcare specific, which is definitely something we're always excited about on this show. So
For sure.
That's really interesting. I think it's really cool to see that kind of facial recognition algorithm being developed. As more than should you hire this person who did a recorded video interview for your company. So that's really neat.
Yeah, and we have a second one too to talk about. So the second article is about using NLP and to analyze text documents to find summaries of really lengthy text documents. So some scientists at Salesforce have developed an algorithm to do so. And it's a combination of two processes. So it uses supervised learning to learn from good examples of summaries, and it also uses reinforcement learning to reward the algorithm for not using too lengthy of strings of text or repeating strings of text as well. And that can be helpful too for a lot of academics and people who are doing research, because there are so many research articles out there that it could really help in that field.
Yeah, I feel like I don't really have time to even read the news, so it would be helpful for that too.
Yeah, definitely.
But that's a great segue into summarizing text, which is what's going to be the hands-on portion this week. So if we look over at my screen, I'm going to use this R package called Tidy Text to do some text mining, and we'll just do a quick demo of what that might look like. So let's head over to RStudio, and I probably need to make that bigger because I doubt you can see it on the phone. through the internets. Okay, so there we go. So I'm going to load a few libraries here, and we'll share this code after the broadcast so you can follow along now and then run it yourself later. So I'll just run through it real quick. So this library is a corpus of all of Jane Austen's books. And we're going to load this dplyr library, which if you know R and data manipulation, you'll know dplyr because it is the package for data manipulation outside the base. So we can, one thing maybe you haven't seen is this pipe operator, which means you can take the output of one line and use it as an input to the next line. It's equivalent to the dot operator in pandas. So, group by blah, 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 dot, dot, dot. So it kind of strings commands together. So this little block of code here is going to take that data library and load it into a way that we can look at it, which is, it's got the book, the line, and the text that's actually on that line. So if we look at a different portion, you can see the text that's actually in Jane Austen's book there. And so natural language processing works, we don't care what line the book is on, so we want to move things into words. So we can load this tidy text library, and that's going to go from lines to words and put them into the tidy text format. So one thing that's a little quirky about R is that every package has a little bit different they all look a little different. They all use slightly different data sets. This one has what it calls a tibble, and that's specific to the tidyverse, which is the universe of tidy packages like dplyr and tidy text. And so a tibble is kind of like a text data table. And so this one has, now we've gone from line by line to word by word. But one common thing we have to do in natural language processing is remove the stop words like the and that we don't care about. We're not going to get information from those. So we can load this library of stop words and remove the stop words from that list. So now that we've done that, let's count the words and just look at a distribution of them. So the most common remaining words are miss, time, and fanny. Okay. Interesting, but that's kind of like, so far all we've done is count words. We want to do something more than that, which brings us to this tidyr package, which contains this sentiment library called get sentiments. And so we can see that things like abnormal and abolish and abominable are negative things, and A+ is a good thing. So finally, now the real exciting part, we can take that sentiment library and apply it to the text corpus we've cleaned and organized across all of Jane Austen's books. And drum roll please, here we go. We now get a plot of sentiment across of all Jane Austen's books. So, as the pages turn, is the tone of the book negative, positive, or kind of neutral? With the amplitude being how negative or how positive, and the x-axis being where in the book it is. So the takeaway, I guess, is that natural language processing is cool, and that Sense and Sensibility ends on a positive note.
And that's the thing that I find so fascinating about NLP as I've been getting into it, is that there are so many different areas and ways that you can take NLP. So we've heard two examples here. One is just taking articles and being able to summarize those articles in an easy to understand way, and then actually output that information into sentences that humans can understand. And then something, on a totally different is sentiment analysis and looking at the words and the positive and negatives and how that trends over time in an article or book or whatever it might be.
So one thing I forgot to mention about that package is that it's actually written by a Salt Lake City local, Julia Silge, who had plenty of internet fame over ordering a pizza for Senator Orrin Hatch a few months ago. But yeah, I'd encourage you to check all that out. So with that, let's get on to the main event and let Mike do some talking here. So, enough of me. So Mike, can you go into your background a little bit more? How did you end up as the natural language processing guy at Health Catalyst?
Sure. So it's not a direct path. So I started my career, computer science background, started my career at one of the major EMR vendors, and found myself after just a few years discouraged by our ability to effectively deploy EMRs and have physicians really love and improve what they're doing with the EMR. And so joined a consulting firm, helped start that up, where we focused on EMR implementations. Did a lot of great work, really proud of that, but by the kind of early 2010s realized that that wasn't really the future of where healthcare technology was going, and joined Health Catalyst because analytics is, I believe, a very strong area for growth and very interesting in what we can do and how we can improve what our colleagues do in different health systems across the country. Started as in strategic implementations at our clients, and then towards the end of last fall became aware of what we were doing with NLP. We had partnered with a really great organization called the Regan Street Institute, and they're providing the technology, and we had needed someone who could bring together a lot of different groups, which is a bit of my background in management, and bring those folks together to deploy this and make it a scalable solution that we can spread across and make available to all of our clients.
Okay. So I guess with that, like, what does natural language processing mean to us as a healthcare company? You know, we went through like books and sentiment and articles, but you know, how is healthcare different?
Yeah, so like we said, there's so many different applications of it. One thing that we were talking about, just to kind of push it even further away from some of these basic examples, is we're talking about my time in China this past fall. We were in a pharmacy. We needed I was sick. We needed some medication. Went into a pharmacy in a relatively small city, which was like about 5 million people, but a relatively small city, and none of the pharmacists or staff spoke English at all. And so by that time, it was about 3 weeks into our trip, we had started using an app called WeChat, which is like WhatsApp. And by using natural language processing, you're able to type in a message in English, have that sent to the recipient, and then they get it, click translate, they write a response in Mandarin, and then it comes right back to you. So NLP touches a lot of different areas, and there's a lot to it. Within healthcare, what we're seeing primarily is, first off, looking at clinical information, so looking at physician notes, radiology reports, pathology reports, and being able to pull different information out of those different sources. And so we may be getting to this, but where it's most predominantly used right now is in a field called computer-assisted coding, essentially making sure that when a bill goes out or a bill is being created for a patient's visit, that bill accurately reflects the services that were provided, the diagnostic care that was provided, and essentially making sure the health system gets paid appropriately for that.
And I guess it's not always the case that diagnosis will be contained in discrete fields, right?
Yeah, the diagnosis and we performed this test,
treatment,
or
exactly.
we recommended this, and a lot of times with just like an outpatient care, how much time was spent with the patient and what recommendations were made, even if it wasn't a particular prescription or a lab test that was ordered or a diagnosis that was identified, just how they talk through that visit can make a real difference in terms of what is charged for that visit.
And just out of curiosity, you know, we talked about sentiment analysis. Is there sentiment in these notes that could be useful?
Perhaps.
Or are they
that's an
more
area
dry?
that I haven't really seen much work in.
Are they pretty dry, usually? Kind of like, here's what happened.
Yeah, they're pretty straightforward, and increasingly there's a movement to share notes with patients, so it's really for all eyes to see, so that they aren't particularly colorful.
Great, thanks. So then how would this clinical notes and extracting information from the clinical notes, how does that lead into or aid in machine learning in healthcare?
Yeah, so talking about it from that perspective, you kind of look at the interplay between NLP and machine learning in two ways. One is how machine learning can help with the natural language processing and aid in those processes and help remove humans from doing all the logical programming of how we use NLP. And then, so that's one direction, but I think you're talking about the other direction of how we can use natural language processing outputs to aid in machine learning. And so we just wrote a blog. I think you kind of primed this one, but we recently wrote a blog on this exact subject. And so the idea is that there are a lot of risk scores that are out in the field, so to speak, that physicians use to understand the risk of a patient being readmitted for a particular condition, or the risk of the 10-year mortality rate for a patient for a certain condition. And those risk scores are great. They're widely used by physicians. They are often used as patient education, especially for the risk of heart attack, for example. If you stop smoking, that's the biggest thing, if you're a smoker, that you can do. Reducing your cholesterol, reducing your blood pressure, those move the needle a little bit, but stopping smoking will really impact things. And so the physician can say, hey, if you stop smoking, you're reducing your risk by almost 50% of having a heart attack over the next 10 years. The trouble is a lot of those risk scores require information that's not discretely coded into an EMR or other clinical system. And so if we can use NLP to extract, the certain values like the ejection score value, or if a patient has had a
that's like heart performance.
Heart
performance.
Yeah, if you have heart failure, ejection fraction is a good indicator. That number is a good indicator of how healthy your heart is.
Okay. So in this case, you're saying that ejection fraction might be a discrete field, but a lot of times it's not filled out because it's just written into a note. And so
exactly.
we really like to use it in a machine learning model, but it's not always available as the discrete data.
Absolutely.
And does that apply for, you mentioned smoking status, but does that apply for other fields as well? Kind of like.
Yeah, the example that we gave in the article was TIA, which is essentially, at least for the layman, it's a mild stroke. So stroke, if it was treated in a hospital, that will absolutely be what was the diagnosis, what it was treated for. But a lot of times a TIA will just be history of it, and that's often in a note. And so that type of event, we can use that again in a risk score like the CHADS-2 risk score.
And I guess that the other thing about that would be useful is that you might see a TIA in a discrete field from 10 years ago but not be looking there, whereas in the note it might be documented in the patient's history for today's exam.
Exactly.
Right. Okay. So natural language processing can definitely help us build better machine learning models.
Absolutely.
Which I guess is a nice segue into, where is healthcare NLP and related to all the other industries? Because it seems like healthcare is pretty far behind where the web is. We just went digital a few years ago. So is it realistic to say that we're right there with everybody else in NLP, or are we hopelessly far behind?
So, as wide-ranging as NLP is, there is a range of answers to that. I will go back to where we're doing well, in my opinion. The computer-assisted coding and computer-assisted documentation improvement, essentially making sure that health systems are billing for the correct level of visit and correct services that were performed. That's very advanced. Probably not surprising because there's a direct tie-in between financial and the work that we're doing. And so that's computer-assisted coding. We're doing really well there. In analytics overall, it's actually a very nascent area. We recently had conversations with different industry analysts like Gartner, and outside of IBM and Health Catalyst, no other vendors, in their opinion, are taking a really strong interest in NLP and doing anything more than paying lip service to it. So, and that's not a knock on other vendors. That's really an indication of where we're at as an overall industry and what generally health systems are looking for.
That's great. Some of the stuff is amazing. I guess, like, where do you see NLP going? Because are we going to have doctors working in one language and patients in another language?
In translation
services?
I guess.
I mean, I'm like, what's the moonshot here?
Well, translation's a fascinating area. That's more in the area of machine learning and deep learning. But I think the long term for NLP is over the last 10 years, we've seen just this crush of requirements on our clinicians, nurses, doctors, in terms of documenting discretely in ways that we can report on to support meaningful use and other metrics and programs. So they've really been put through the ringer in terms of documenting a lot of information and doing it in all these different fields. My aspiration is to be able to reduce that burden and allow physicians and other clinicians to continue documenting the way that they've done for decades and decades, and doing that through a narrative note.
I guess you could say that would be an interesting kind of ethical thing, because like having the discrete field there gives you the benefit of the physician has to actually think about that and fill it out. If you went to entirely free text, you just hope that they'd write the same amount of detail for every patient from doing machine learning standpoint, But I guess
there are ways to monitor that.
Yeah, that's true. And I guess they can skip the boxes now if they don't want to check them.
Oh yeah, people find all types of ingenious ways to avoid alerts in mandatory fields.
So maybe that's one option of a moonshot. Back we use NLP to rewind 50 years, and now we can digitize any handwritten note, and we don't even need the discrete fields anymore.
I didn't say handwritten, but
well, now we can pair computer vision with machine learning.
All right.
I guess.
So we have a question from the chat.
Okay.
Great.
If we can work that in.
Let's do it.
Yeah, I'm not sure if it's relevant yet, but Cody Coonrat asked, who would you say is doing CAC or CDI well? Are you aware of?
So I'll freely admit I'm not an expert of the different vendors in that area. The one that often comes to the top from the limited reading I've done is 3M.
Mm-hmm.
Just a big name in general, and they seem to have, based on what different industry analysts report, they seem to have a really good solution. But I'd honestly go to Gartner reports, Chillmark reports, and other analysts for specific recommendations there.
Great.
Thanks, Mike.
Thanks, Mike. So
You're welcome.
I had another question about, could you, you've alluded to a little bit of this, but what do you think is like the ripest cases for NLP in healthcare right now?
Yeah.
Like, what are we going to address first,
Yeah, so let's talk about that. I want to come back to the vision because I think that's where machine learning comes in a lot more. But the ripest cases, so it's absolutely the computer-assisted coding, and I think I wouldn't call it a solved problem, but that area of the market's fairly well mature and fairly far advanced. The next big area is what I'm personally involved with, which is being able to bring in information that's currently just in text and we can't use in traditional analytics tools and be able to bring that in. So it's a lot of what we call information extraction. So we go back to that example of the heart failure patient and what their ejection fraction score is. That's in a textual report that comes from a diagnostic testing equipment. And somewhere in that text is what the cardiologist and how they interpreted the report.
Yeah.
We can take that number and pull that out and then be able to identify our heart failure patients, not just based on diagnoses, but based on their ejection fraction score as well. And there are a lot of other use cases: cancer staging, cancer tumor staging, cancer tumor size. Where we're pulling out specific pieces of information and being able to run analytics on what those data points are and a lot of times what those numbers are. And then cohorting is the other big one. So being able to identify patients who have a specific condition or socioeconomic or impacts. Just the information that the physicians may write about a particular patient. Those are areas where we can pull that information out and either surface that information to the top and show in the EMR some of those top socioeconomic factors, or be able to run analytics on it and pull that information out.
Great. Now I'm going to play devil's advocate a little bit and give you kind of a curveball question.
Sure.
So you saw me in about 5 minutes pull sentiment from Jane Austen's entire, library.
Sure.
So why is this so hard?
So the things where we focus on with the tool from the Regan Street Institute, things that we focus on, and we analyzed a number of different vendors when we were looking at different partnerships. And it all came down to being able to identify context. So understanding the difference between a patient who had denied history of diabetes and a patient who actually had diabetes, or a patient whose father has diabetes versus a patient who's actually has diabetes themselves. So a lot of that context and understanding what's going on with them. It was the ability to extract specific information, not just with machine learning. I know you can get more specific, but with that example, you're looking at the broader overall. But a lot of times with healthcare analytics for health systems, we're looking at specific patients and be able to extract a piece of information for them. The other thing is being able to do this, and well, I guess we could do this with machine learning, be able to automate the extraction of information and then bring that back into a data warehouse. Is that something we could do with R and Python?
I think we could, yeah.
Okay.
So then what about scale, I guess? What about scale? Like, I did it on 6 books, which is a lot of, that's a lot of text, but how does that compare to, what you're going to be deploying?
Yeah. So we use more than a laptop in our implementations. The largest installation that I'm aware of with the technology that we're using, they have about 230 million notes across nearly 20 million patients. And when any types of queries are run on that, it's sub-second response time. So if you're looking for all the patients that have diabetes mentioned in their note, or TIA or whatever it might be, that comes back as quick as a Google search.
Right. So the kind of stuff I'm doing here I did here was, it's a nice example of a fun exercise you can do with NLP, but it would take a lot more to build it into a scalable product.
Yeah.
And
they are, I will admit that, when you look at most of the NLP solutions across the board within healthcare, we're focused on information extraction, cohorting, maybe a little bit of n-gram analysis. Sentiment analysis isn't something I've seen the different vendors be very strong at. So that may be an area where, right tool for the right job. So you may for your notes and clinical documentation really lean on the NLP solutions. If you're trying to do a sentiment analysis, R and Python may be the best way to go.
Got it.
That we have another question that relates to what you were just talking about, but Malcolm Charles on chat, he wants to know about the technology stack that we use or we think is best suited for NLPs, like R, Python, Spark. Do you have any?
Yeah, so I'll talk a little bit about what I'm familiar with.
I can talk a little bit about what I'm familiar with.
Okay, great, perfect.
Go for it.
So you look at it as multiple different layers that you're working with. From a document storage standpoint, when you start talking about hundreds of millions of textual notes, so paragraphs and pages of notes, a big data solution seems like the best option there. And so we use HDFS for document storage. When we're running the processing through what we call an NLP pipeline, but a series of processing events to be able to identify what notes we care about and then pull out the right context, so get rid of any negation, any family history, that sort of stuff. There's a series of things that we need to run, and Apache Spark is really great for that. For the actual indexing, which comes a little bit before, I'm going out of order here, but comes a little bit before, when you're looking at document indexing and text search, the two big ones are Elasticsearch and Solr. Both are based on Lucene, the base technology. But at the end of the day, those are like the core technologies and all the general infrastructure around Hadoop in terms of just all the different technologies around Hadoop to facilitate that. But that's just all in the background. What Regenstrief has done, and I think any vendor that's going to be really successful in this space, has made that very accessible through user interface to allow people to build those searches and information extractions. And then also something that's really important is also validating that information, having clinicians like nurses be able to validate the information that you found is actually correct and appropriate for your use case.
That's definitely an advantage to a big kind of heavy commercialized solution, is that validation is built in, because I know validation is very hard in natural language processing especially. All machine learning needs validation, but it can be hard without new labels,
Yeah, and I could probably talk for another 30 minutes on this, but I think the best way to kind of redirect is that we have a webinar coming up on July 12th where we actually go into the specifics of that in a lot more detail about what's important about NLP. With all our webinars, it's a lot less about what we're doing and what our products do, and more about education about how to approach these different problems. So I don't quite remember the name, but the person who asked that last question, I definitely recommend checking out that webinar on July 12th.
Yeah, and for your own information, in the experience I've seen, R and Python are both capable of doing machine learning or NLP, also machine learning, but NLP. And it does seem like Python is a bit ahead in the field and that people tend to use Python more for NLP solutions. But we'd love to see you engage your own NLP work ideas and workshops in the Slack channel. I'm sure there's a whole bunch of people that would love to see what you can do with words and text and bags of words. So feel free to post anything in the Slack channel, and I'm sure you'll get some, at least some thumbs up emojis. Mike, thanks so much for coming on to the show this week.
Absolutely.
It was really great to talk with you. Ethan, thank you for coming on and monitoring chat for us. I think we had a really great interaction with the audience, and we look forward to seeing you next week right here in this room. So thanks a lot, everyone.
Thank you for joining us today. Remember to like, share, and subscribe, comment below, and click the links below to join our Slack channel and our Healthcare AI community.